Today, our guest on this episode of the Nigerian Dream podcast.
So I asked him how does he feel about the work? He told me that he's just here because you know the solution. You know this person can have a high chance of surviving. This one wants to take wants to just control me. Yeah. I'm no longer a student doctor. You don't have the right to tell me that. I'm not a doctor of my own. Get out of here.
Today, our guest on this episode of the Nigerian Dream podcast is someone I respect a lot, a classmate, a fellow medical student, and someone who is passionate about transforming the Nigerian healthcare system. Join us as we discuss the issues plaguing the Nigerian healthcare system and possible solutions to them. Good afternoon, Joseph. How are you doing today?
I'm very great. Thank you for having me here.
Well, the reason for this interview is I've seen your interest in trying to change the Nigerian healthcare system,
Okay.
and I think it's very necessary we nurture it from where it is now, and eventually probably we can even get a solution. So, what made you first to start thinking deeply about the state of healthcare in Nigeria?
Okay. First, it came from a silent observation. One of the times I went to the hospital and I just saw the apathy of doctors. They are not like that enthusiastic. I even had to speak with one of the doctors, because he's someone I know. So I asked him how does he feel about the work? He told me that he's just here because he doesn't have any other thing to do.
Hmm?
Yeah.
Continue, Abe, continue.
So
That's crazy.
So it doesn't have anything to do that, it's just doing the work. And so it shows that we actually have a lot of work to do, and also being in various hospital settings, you see nurses being agitated, the matrons is a very common something. Matron nurses, I don't know, they're always having this. So I feel like it's a very deep rooted problem. And also listening to the news, I said, why not just create an ecosystem, where everybody will feel seen, everybody feels heard, and let's start when we are younger. Because if you get there, if you tell them let's collaborate, they will feel like they don't know what you're talking about because they are really grown up to experience that. But when you start from when we are young medical students, everybody is already a culture. You have already understood collaboration. So I think most of for this podcast, we're talking more about collaboration as you know as the health field, because I think that's where the solution of the problems we have as the Nigerian medical health system. I think that's where the solution lies.
With collaborations,
Yeah, collaboration with every sector of health.
every
You
sector
know,
of health.
the community health, the pharmacists, the nurses, all of them. We need collaboration to be able to foster this oneness in us.
Okay. Aside collaborations, what do you think is the major problem with the healthcare system of our country? Is it funding? Is it leadership? Is it structure? What do you, from your own perspective, from what you have seen?
I think the major problem in the Nigerian healthcare system is the structure, the hierarchy, the hierarchical structure of Nigeria, because most times there are solutions to problems, but it's just that people that are in charge don't actually know how to make sure that those problems are solved and the solutions are met. And also one of the other problems, yes, structure number one, like you said, funding. And I think that funding is what helps in keep, because another problem I have mentioned, but the funding is the solution to that problem, is the Japa syndrome we are aware of. Why funding is a problem. And then one of the problems I actually observed from this Nigerian healthcare system is, first, most people actually go there with the passion. So most people will say you don't have this passion again, doctor doesn't have the passion again. But the passion is there. The problem is the dignity is lost. For example, now if you are a radiographer and then you come to do your job as a radiographer, and nobody the work job is not being done well, and you know the solution, you know that this is, like, for example, now you're a doctor, you're trying to check the BP, and you know that there's a machine that can do that easily, but you're just relying on your hands and maybe what
Pulse rate.
your pulse rate. You see that you know the solution, you know this person can have a high chance of surviving if you had so, but you can't, and just see your patient die. it's very morally degrading. It's very
Person
emotionally
begins to
degrading.
lose hope.
Person begins to lose hope, like in the whole process. The person goes out, yes, for money, but when the person gets there and see that it's not only about the money, they also value him as a person. He actually stays there and you know enjoys it. But so it's not necessarily about the funding, but the funding can solve most of the problem of the next. But Japa syndrome actually is one of the is a very
Serious
widespread
problem.
problem. Yeah, everybody was trying to go away and everything. But the structure is the main thing that causes the funding not to be there. Because if there is a good structure and if everybody understands themselves and we do this we center this our health, the health field, the health, yeah, in the health field to be patient centered, not necessarily about you as a doctor, your ego, or whatever. We all care about the patient. We have heard a lot of stories about um a lot of stories about lack of collaboration in the hospital, doctors feeling like the boss, the pharmacists fighting against doctors, the matron, won't even let the attending staff, maybe the student's doctor, to actually do his job. She'll giving him orders because maybe she feels that she has more experience, which is true anyway, but the approach and everything. So yeah, is the hierarchical structure of the system. That's where the major problem is. From there stems out the branches out to every other problem that
I think
we have.
you said something about ego, whereby this person feels that they
Yeah,
are more
yeah,
equal to this
yeah,
person,
yeah,
and then it causes conflict even in the hospital.
yeah.
Yeah, that is very true. Well, I think one of the, if not the major problem, yes, structure is a very big problem, but I think the major problem is funding. I think
100%.
I've said this thing before, but we cannot actually afford. Nigerians can't afford. I don't say if I say Nigerians, it might just seem as if I'm trying to stereotype, but then we can't actually afford healthcare, quality healthcare, because if with the level of poverty and level of poverty and then the amount of funding that is allocated to the Nigerian healthcare system is not. I think it was supposed to be 15%. There was a time when it was agreed. I don't know which set of countries agreed they would put 15% of the budget towards healthcare, but then that's not what it has been. What's it called? The government does not allocate proper funds, and then the funds that are even allocated are usually, some of them are boycotted to other places. Some people steal funds. These are just, I mean, these are just, will I say, I'm saying this allegedly. That is, I don't know. I've seen some things in the news, but then I can't really confirm this. But
Okay.
at least that is the only possible explanation, because there's no explanation when funds come for development of the primary healthcare centers. Like I saw one doctor posted today. Sorry, I say one doctor, one video he posted today of a primary healthcare center, whereby I don't know where the doctors were when they were even making the video, because I did not see any doctor. I
Okay.
think they were just midwives. The building is a big building, but then the places were empty. The hospital bed, the beds were, will I say, ancient of days. All the what's it called? All the I never even see any modern equipment. I'm just
Okay.
wondering, for a primary healthcare center,
Yeah.
it's supposed to have all these things. It's supposed to be like a teaching hospital. That is what a primary healthcare center is. But then that's not what it looks like at all. So a good doctor is another big voice in somebody that's trying to also change the Nigerian healthcare system. And at least we need many hands on deck. And the thing is that many people are not thinking towards that direction. At least many people that are studying medicine now, their own is just to go there. And many people say they are going to go abroad, so it's not even really their concern whatever happens in Nigeria. But what of the people that actually stays, that are going to be in Nigeria? Who is now going to be treating them? What happens to their own healthcare? Is it that the government is going to leave them to die, or the doctors that are trained in Nigeria and now go abroad are going to leave them to die? And then I cannot really blame them, because yes, it might seem selfish, but then it's not selfish. Them too, they're also trying to survive, because you cannot just be working. You go spend 3 days in the hospital, improper conditions, and then they now pay you 300K at the end of the month. What is that?
Yeah.
I know, say me, I know they collect some sharp. But yeah, that one is, by the way. If you could,
Okay.
what's your own meaning of structure? That is, if you could redesign the healthcare system, how do you think it should look like? How do you think it? What's your own idea of an ideal system, ideal medical system, healthcare system in
Uh,
Nigeria?
an ideal healthcare system, in my opinion, would be a system where it is decentralized. Not one person has full
Explain
control.
decentralized.
Decentralized means, most of the policies of healthcare systems in
Yes.
Nigeria is coming from the federal government.
Yes.
So, but if it's decentralized, that's every state is in charge of whatever happens in their this thing, in their healthcare system. But though they get directives from the general, federal,
Surgeon
yeah,
General.
yeah. So, but they still have to say, okay, this is how these things work. I think the Enugu made the Enugu government made a move, trying to rally against quack nurses. That was a very good move. So I don't know. People,
What was the move
he
about?
noticed that there are many quack nurses that actually have the papers, the
Qualification.
qualifications to do their job. So he fought against it, trying to make sure that they are not, doing the wrong job, because most of them just go learn it as though they are learning a skill. But there were some controversies, people saying that some of the so-called quack nurses actually have a better hand at the job than the. But you see,
Non-quack
yeah,
nurses.
but the main idea here is that you see how the Enugu government actually took that move when waiting for the federal government
federal
to
government.
to make the move. So he made the move to make for what he feels that is better for his state. But most times the state don't actually care. When someone comes to power, what he cares about is building roads, those visible things.
Yes.
I think that's what even Nigerians are fed with. They just do the visible things, they build structures, what you can see and remember. But all those health, how was the health standard of the place improved? Not even about building hospital. How was it managed? Because the hospitals were not in that, like you mentioned the story of a local doctor videoing a place. The place was shabby and everything. But it was not in that state when it was built. So it was in a good state. So someone has to maintain it. Sometimes the paint will peel off and all that. Someone has to repaint all those stuff. So first, it has to be decentralized. Every state is responsible for how their healthcare system is. So if every state is struggling to make sure that their healthcare system is improved, you see that okay, person is asking for maybe 100 million naira or so and so 100 billion to make sure that his the healthcare of his state is improved. Everybody is trying to
Did
make
you say,
sure.
did you say 100 billion just now? Do you think 100 billion, if
I'm,
they
I'm,
do,
I'm
I
just
know you're not estimating that, but 100 billion, they mean to send amount for the entire country, not to talk of one
so
state.
so yeah, that's the major problem. And the thing is, you have to decentralize it,
Yeah.
decentralize the system. Let every state have full control of how health is being run in their states. They'll be getting directives from the federal government, but they too will be giving directives on how the things will be run. Because some communities have their own rule. So you can't just send out um okay, if you're talking about lack of personnel, you can't just send out 50 personnel to this community. Maybe they have their own traditions that the personnel cannot bear with. Maybe all these local governments and all these people may have their own tradition. Maybe at social time they have their mall festival and they flog whomever is working out, moving out in the as walking about. Some of these local people have their festival. So it's either you have to sit down with them and tell them, okay, whenever you see a doctor on duty or maybe rushing out to go with an ambulance to get a patient, don't stop him at the way, don't ask him for money, leave him to his job. If people can come with that agreement, good and fine. But if you cannot come at that agreement, then you have to make sure that doctors actually know what they're going in for, not just going in there. But the federal government won't be aware and it just sends out people inside there. But if the state government is the one in charge, he can easily it's easier for him to communicate with the local government and be like, okay, well, what do you think we can do to improve your healthcare system, the healthcare system of your, yeah, and every state, since everybody is fighting to make sure that state is a good place for health, somewhere you can just call whenever health comes to mind, it's going to be easier for them to handle. Then I think the second thing we should work on is then the way positions are given in the healthcare system, because most times positions are just given to doctors. It has brought widespread debates. Why is it only going to be doctors that are on seats? I won't say doctors are not qualified to be on seats because they actually do most of they study. Let me say, yeah, they have a touch of every study. Like intellectually, they are more capable. You know, broadly.
Not that one was about controversy, sha, but then just continue. Continue.
Okay, okay. So another the second solutions, if I were to given the opportunity to change the healthcare system, is to watch, like I said, the structure. Structure is not necessarily about the buildings or not necessarily about the leadership. Yes, but what I'm trying to talk about here is now the leadership positions, how they are being given in the healthcare system. Most times in hospitals, let's start from the hospitals, they are being given to nurses. Like if we are giving the chief nurse, most times it's the eldest. Most times it's the eldest. Sometimes they will do give it to some of people that are younger, but it's not. They always give it to you by your years of experience. Yes, I think also one of the major problem now is that most times the experience actually matter in health. But do we know how capable the person is to be a leader? Because sometimes they may just be a person that is very arrogant, can't even um, lead people well, but we just give them position because they have been they have a very old hand in the job. They know the job very well. It is good in patient care because when it comes to hard situations, maybe trying moments, maybe where we don't the doctors don't actually know what to do, or the nurses don't actually know how to treat these patients in this situation. The matron, who is the elders, they can actually give directives. Or in the hospital, sometimes the director there is a very old doctor, But one thing is the oldness, them being old is first they are very strict with tradition. They will be hard for them to change tradition
Very
because
conservative.
yes, because they're very conservative because they will be like, "Oh, this has have been done, that we haven't gotten any problem." But though there's a very new solution to what the problems, like to solve the problems, but they will just choose the one that are very they already know they want to play it safe and it doesn't actually. So I think it's going to you need to recycle leadership over and over and over. So you can say the matron stays for some while and then it's transferred to another person who proves competence by how he or she has led the hospital, have handled patient care and all that. Then if it comes to getting the good hand in the job as a result of your years of experience, you cannot have consultants. Consultant can be available in the hospital. Maybe you need someone that is old, that has a very old hand in the job. Maybe someone that is a very as very old nurse can be a consultant nurse, or someone that is a very old doctor that have been there, you know, can be a consultant doctor, and then you can ask him for directive, not necessarily being the leader. So even the young leader can actually tell him what to do. But when it comes to patient care, but that's why I said earlier, it's all revolved around patient care.
Let me even just cut you. What do you mean by directives? What do you mean by the directives in doing what now? Is it in practicing the healthcare or how the entire healthcare, this thing is going to be run? How the hospital is going to be
Yeah,
run?
I think the solutions to help the healthcare problem. Though the federal government gives a general directive, this is how things should be done. But also in the hospital, that there are little things that matter, and that's what the patient experience. They don't experience the whole rules from above, from the government. They experience how the main hospital is being run. So if that can be done well,
How the hospital is being
yeah,
run?
every doctor wants their hospital to be run well.
Do
If
you
I,
know? Do you know something?
yeah,
In what's it called? I spoke to one doctor not
okay,
too long ago. He said that I don't think anybody, unless somebody that is like a Jessica and then the person is not fit for the position, but
okay,
then I don't think anyone would want to let their hospital, especially for the person to even become a doctor, have years of experience, and eventually become the director of that hospital.
okay,
I don't think anybody would want their hospital to be run badly, unless the person does not just know what he's doing.
okay.
Yeah, so he said that the major complaint was funding. That is for yes, funding.
Yeah, that's a very good.
If my solution, what I think should be the solution, is insurance. And yes, the Nigerian government has done, well, how will I put it now? They mandated insurance for all citizens, that everybody should have insurance and stuff like that. But then I don't know whether this is purposeful because they're not actively,
Working on
well, that's advertising. They're not actively marketing the importance
importance
of
of insurance.
insurance
Yeah.
around the country. Maybe they've said it, but many people don't read all these laws and stuff, and many families don't have health insurance. And Nigerians, because of the, I don't want to say, because some people are still superstitious on why would I be paying money when I'm not receiving any care
Yeah, yeah,
at that
that's a
point in
good
time.
point.
So it's going to be difficult to be able to convince
Them.
them to be able to pay insurance. If you just do it, if you approach this thing lukewarm, as with a lukewarm attitude, you're not going to be able to get anywhere. So I believe insurance is the best way, because whereby everybody contributes, everybody is paying their insurance, then maybe this particular person, depending on the what you're the plan that you're paying for. So that if someone that wants to do a very expensive surgery and then cannot afford it at that point in time, with the use of the money from insurance, he can be able to use to cover it. And then the reason why these hospitals are, I think, the reason why these hospitals are underdeveloped are because whenever people come to treat themselves, some people might not even have the ability to pay at that point in time, pay at that point in time. So the equipment that will be used for that person,
Yeah.
the person might not be able to pay for it, so they will not be able to replenish that equipment and maybe other equipments that are used in the hospital, syringes, they might not be able to get more syringes and all that. Sometimes, that's why sometimes when people go to hospitals, it just seems as if the hospital is underdeveloped or as if it's the hospital's fault. Meanwhile, and it's not necessarily the management's fault because then they need to, and they cannot just turn down patients, especially emergency patients.
Yeah.
But when you now have that emergency patients that cannot now pay for their bills, but then the doctors have to treat them, and then they are still going to use these resources. It's not going to be possible. Where are they going to get the money to handle all these things? So I think the federal government should allocate a good percent of the budget, 15% as it's supposed to the healthcare system so that they can be able to fill in for all these gaps while the insurance system is working properly. They should also use federal government should also fill in these gaps. Yeah.
Okay.
So what
But
do you think? You have something to say? Yes.
yeah,
Yeah.
another thing I wanted to add is, don't you think one of the major reasons why this healthcare system is the way it is the culture, the health culture of, you know,
Health culture. How?
yeah, because like I said, that hierarchy stuff,
Yes.
yeah, like not necessarily like just the mindset
Oh,
also plays a role, you
mindset
know,
of who?
because here now we are already talk about the infrastructure, but what about how patients are treated, how, the emotions, the everything. And we want to talk about how staff in hospital actually treat themselves, because that's invariably that deflects to patients. Like if staff don't talk to themselves well,
You
you
see,
know
I
they
think
don't communicate well. Everybody just is everything is the same. Everybody just wants to do their own thing. The lab attendant just wants to do it. What he cares, just see the slide, do what is there, and they tell you. Everybody just cares about their own job. It's going to make, like, I had one of the stories that made me think about bringing this up is one of a pharmacist complained on social media that one doctor, after prescribing drugs for a patient, pharmacist in the hospital came and he wrote what he wrote. So there are two things involved. Is that the pharmacist believed he's not competent enough to be writing the drugs, that why like, I don't know, or maybe he saw a loophole, maybe saw that the drug may be actually harmful to the patient and wanted to correct it. So the manual approach was wrong. But what if also maybe he tried to tell the doctor and doctor didn't care or what he was saying? So maybe he had to just do it to, make sure the patient was safe. But you see that the outcome of the whole scenario was wrong.
it's lead to a
It
conflict
could
because
lead to a
it be
conflict.
as if the pharmacist is
So that means that,
undermining
yeah,
the doctor's
or maybe,
prescription.
yeah, and maybe what the pharmacist actually tried to talk to the doctor, and the doctor
And the doctor did not
didn't care, because
listen.
we have seen, most of us have gone to the hospital and see this kind of situations.
And then for the patient's point of view, the patient can actually know who is correct because
Yes,
patient
patient does,
is
yeah,
not a medical personnel. And this is also a valid point. And then this is still boils down to the frustration of the healthcare system because
yeah,
I think if everything was running smoothly
smoothly,
or
yeah,
close to smoothly, people will not be this frustrated. As people will not act like this. I think people act better. It's just the conditions. Yes, there are some problems. Even if the government decides want to wake up in the morning and do everything the way things are supposed to be, and then everything is just the way it's supposed to be. The healthcare system is on point and everything. The what's it called? There are still some people that then those people are not even supposed to be there. Maybe those people are the people that are forced to go and do medicine or study whatever
yeah,
course that they don't actually wanted to become.
yeah.
They don't actually want to become doctors.
Even studies have shown that, like, a reasonable amount of doctors we have in Nigeria
Yes.
initially, sorry, a reasonable amount of non-doctors, but in the reasonable amount of health personnel, that's radiographers, med lab
Yeah.
scientists initially wanted to be doctors, but they had to reflect because of maybe poor
Jam
jam. Yeah.
scores. Yeah.
So imagine in a situation where this has always been your dream, you know, and you are forced to do something else, but maybe because you are not capable of doing the one that you initially wanted, and then you're now sitting there in the hospital, and then someone that is sitting where you always dream to be is giving you directives. You will never feel comfortable, you know. But one thing is problem now. Why don't people actually go willingly to do med lab
Yeah,
and
I
do
want to, I want to even say something on that one. It's because even in university, yeah, if you see a medical laboratory student, you don't really, they don't, how would I put it now? If you're trying to show, will I say hierarchy? No hierarchy. If you're trying, yes, hierarchy, class. A
yeah.
medical student is here, a med lab student is here, a radiographer is
Why
here.
why is the system
A
like
calms down. Just I'll get there. I'm going to
okay,
get there.
okay.
Which other this thing self? Which other course?
Med lab,
Any other health related
yeah,
course?
all of them.
Every other they are under medicine. It's
Yeah.
because of the attention that is paid on medicine and then the neglect towards other courses because they feel that medicine is more important and the most important. So others don't get to evolve. I think even outside the country, the people that find the vaccines, all these vaccines
Yeah,
to different drugs,
they are
they are
med
med lab scientists, they are
yes.
radiographers,
And they are
they are all these other
yeah,
sub part health related
professions.
professions. I think they are also very very important. Another reason why another way I think they are even going to be very important is this herbal medicine that we use in that all these our forefathers used.
Yeah.
It worked for them during their time, but then present day doctors they are discrediting the use of herbal medicine because they think that they don't really check whether there are microorganisms that can actually affect
And
the person.
some of them discredit as it affects
It
your
does not. They say
kidney,
yeah, exactly. It
yeah,
affects your kidney,
kidney,
affects your
yeah.
this and that, that is very valid. But they are criticizing it, but they are not making moves to actually check. Maybe some people have already done said that this thing is working. This is working for this particular set of people. Yes, but then just take it. You and that person, you and that herbal doctor should work together
And
and
see
test that whatever that potion or whatever it is, and then you cannot make it to an actual drug, and then Nigeria can be known for something because we have the herbs here. Every drugs, it is herbs that they used to make it. We have the herbs here, we have everything here. So we can just utilize our this is another thing. And this I don't think we even need okay, we need money, we need funds for this one, sharp, because but we even if the government can play a role by we can improving labs. I think if you even go to do tests, I pity for God. I pity for all this I pity for the lab scientists because they are not regarded really,
yeah,
they're not regarded at all. Their own is just test your shit or test your piece and
and
then just give you results. As they don't do any other thing. So that's a very boring course. I don't think anybody. That is why you see many people that even study that particular course. They study to just get that degree. Once you get that degree, they venture into another thing. So there's no way there's even I think there's even there's even lacking in specialized people that are actually concerned with they don't even
specialized med lab
yeah they
scientists.
don't even take even those that even study the course they don't even take it seriously like that
It's not because
because they don't want it's not there's no
it's not one of the reasons why
the aesthetics is not good.
yeah,
It's not aesthetically pleased.
no, one of the reasons why they don't actually love it is because of what they have come to see. Because
Yeah,
if somebody like me now, I didn't get medicine and I then had to do med lab,
yes,
and I come out to see that oh, people actually value these people. Like they have done this person is being praised today. Maybe the president announced that
yeah,
there is this lab scientist that discovered that so thing can cure so disease. You know, they gave him honors, gave him rewards for this, and you know, it's because he's a med like everybody will be like, wow, this guy actually did this. He's a lab scientist. He's going to be a person will just be an icon for them. They will look up to the person.
yeah.
So why they do feel you know this
Neglected.
disconnected, they don't want to get too much in, they don't want to engross in their work, or they don't have that passion. We don't see the passion there is because you have already written them off as let them just do what
Was
they
not
want to. Yeah.
important.
If when once the patient is healed, the doctor is the one to be, and then
Don't
they
get
too don't even push further to do because it's a divided problem, not only based on the everybody disregarding them. Also, there too, they don't even push further to do extensive research. There are few research papers from Nigerian med lab scientists I've read, but they have not gone deep. And also, it comes to funding, as you mentioned, they have not gone deep into research. And even radiographers, there are many new developments coming in that field. There are even new ways of doing MRI and all those kind of stuff.
There's this thing. Another thing is in when they study in university,
Yeah.
when you see the way, for example, now practicals, whereby
Okay.
only like five or very, if you compare the amount of the apparatus, the amount of the available apparatus to the amount of students that are supposed to carry out that practical, it's usually like, let's say, 5 to 1,000. Oh, sorry, let me not let me
Five
get
to
some
two
exaggerate.
hundred.
Five
Five
to
to
two
two
hundred,
hundred.
which is
Yeah.
very poor. I think everybody, let's say two people, divide them into groups, and then each person has access to the same particular apparatus. The thing should be this thing. I think the problem is deeply rooted. The problem has to do with leadership from the government, from the top, yes. But then I think there are still some things that we
We
can
can
do.
do.
We can
Yeah.
do, yes. In the part of, so they even there's I think that there are some things they don't even really know how to use. Whatever they just teach them there, they don't get to study further. It is just what is already there. Then they just put it in their head. Then
And
whether or would hey,
pour it out. Yeah.
and when it's not time to get a job, they just get a job in the hospital to be testing people's blood, testing people's shit and piss. That's the only thing they know how to do. They don't. I don't. Those research things don't concern them because that's not what is putting food on their table. In the job that they got as a med lab scientist, only God knows how much they are paying them.
And
So there's
and,
nothing
and
they
we
can
can
really do
also say
about it. They cannot even be inquisitive when they are hungry.
and we can also say the same for doctors in Nigeria,
Yes,
because
yes,
doctors too sometimes they don't even go deep. Like for example now, a patient may have kidney failure or kidney failure, and then you know that there is also comes to the money anyway. But let us look at their own apathy there.
yes.
So maybe you know that this thing can actually work out, but then they'll be like, what's the use of pushing further? Like there's no money, there's nothing. Let me just leave it as it. And then sometimes they don't even know because maybe they just crammed and poor.
Yeah.
And it also boils down to how we are being taught in in the university. They were not taught to be independent thinkers. We're just taught to be just know
Follow
what's in
what
the
is already
material
there.
and give it out. You know, when I'm talking to people about anatomy, are you actually testing their knowledge on how they actually understand how this anatomy function? Or do you ask them? Do you actually allow them to express their knowledge of it? Though the medical exams is very much strict to that regard. In that regard, you know, when they give you oral tests
Oral
and other,
test.
but other professionals, how are they being tested? So you see, all these things is just different different
Different problems.
areas,
Different
different
areas
problems
have different
accumulating
problems.
to have this
One
huge,
big problem in
yeah.
the healthcare system.
So
And the healthcare system is going to continue to be dysfunctional if nothing is done
so
about
I
it.
think can we just talk about what we
Can do.
students can do, like what we
Yeah,
can
that's
do.
what's going to be my next question. What do you think we can do to solve? Because we have been talking about problems
Problems,
since.
problems, problems.
I'm sure you have solutions. If you want to change the Nigerian healthcare system,
Yeah.
you should have solutions.
Okay. Firstly, I said it earlier where I start of this
Of the
video
interview,
of
yes.
interview that we'll start with the structures, how the structures are, decentralize it. Every state is in charge of how the health care in their
State
states
works.
is working. Yes, they should be very much in charge of it. They should be accountable to the federal government. If they hear that, okay, so they should the records of patient death should be publicized. Like, not, I mean, not like publicized, like, no, like the statistics.
Okay.
Yeah, not like
Proper
the
data
name. Yeah,
collection.
data collection. So the statistics, okay, that in this particular state you have gotten 1,500 deaths, and in this hospital there have been so thousands deaths or so hundreds of deaths.
For you to hold
It's able to hold them
them
accountable
accountable.
for why, and not only about death, because sometimes the patient may not actually necessarily die, but their life deteriorates.
Exactly.
So how many brain surgeries didn't turn out well? How many people didn't actually get their life back after brain surgeries? How many people didn't actually get their many people are now left off to be on dialysis for the
Yeah.
rest of their life, maybe because of poor healthcare? And if it's not from the doctor's side, what is the problem? If it's not from the system, maybe from the lifestyle,
Yeah.
the government, like you said, insurance,
Mm.
if it may be because of funding, and we know that insurance is the problem, government can work on that. So we first have to decentralize it and leave everybody accountable. Then secondly is the culture of medical professionals. It starts from from the university. Sorry, start from the university. How do we relate to other professionals? You have bodies, and then we as medical students work together. All these bodies like Catholic bodies and Muslim bodies, and all these first year medical students, medical students of UNN, medical students of UniJOS and Unic. Then it gives them this collaboration. But also, can we actually thought of collaboration aside your own faculty, your own department? You know, with you and med lab scientists. And then I think one of the things, it's just like something that came to mind. I don't actually, I've not test run it and see how it's going to work. But when the doctors are starting off in their what is it called, their clinicals,
Yeah.
going to talk to patients and all that, how are they taught to collaborate with nurses? How are they taught to collaborate with lab scientists? Because everybody's running to get their grades. Nobody's caring about to improve. Everybody wants to get the grades, memorize what you can, say it during the clinicals. Make sure the patients you collect these patients very well.
Yes.
And say, well, are we taught to collaborate with nurses? You get, and nurses in the hospital, maybe the student nurses are actually trying to get their grades. Everybody's trying to get their grades and move on. But are we taught to collaborate? If we're taught to collaborate, okay, if you have this problem, like now maybe a patient doctor now, sorry, a student doctor can be like, oh, I've forgotten this drug for this patient I'm clerking. What can I do? Let me ask the pharmacist. And it's not punished. It is encouraged. Okay, you have low knowledge about this particular case. Or that you're looking for a drug that's going to be very much effective. And you're giving the permission to go and ask the pharmacist. And or maybe about maybe patient care, because we as doctor, what we care about, what we know is the treatment. The way patient is being laid, all these things is the work of the nurses. So but sometimes we do some things, doctor may just give some directives, and that's detrimental to the patient's health, and the nurses complain, or maybe the nurses may even be afraid to complain because they'll be like, is the doctor, all this thing. Another problem now is when some I have not experienced this personally because I've not gone to that level, but some of my our senior colleagues have complained that their relationship with the matrons is very much like, yeah, because matrons will be like, what, all these harsh tones. Matrons are, in fact, the picture of a matron is a harsh lady.
Woman.
Yes.
Soft.
So why does she have to be like that? So you say everybody's afraid of each other, and everybody's fighting.
Yeah.
Everybody's fighting. Everybody just wants to.
So even when you graduate from that place,
Yes, they will see it. They will see
as somebody that
as their
is-
enemy.
yeah,
If they say,
avoid this person.
yeah, if they say,
avoid this person.
okay, I'm going to give this patient so doses of this. The matron be like, from my experience, I've seen a doctor that passed from here, give this so doses, and it didn't work out well.
Yeah.
Why not do it like this? You be like, this man wants to take notes, wants to just control me.
Yeah.
I'm no longer a student doctor. You don't have the right to tell me that I'm not a doctor of my own.
Get out of here.
Again.
Before you continue this video, I know you have not subscribed. Just go down there, just go and click it, just subscribe, just like it, just do whatever you need to do, turn on your notifications or whatever, and just continue watching, because I know that you are fully engrossed with the video, but just go and subscribe, please. Yeah, so that's all I want to tell you.
So they see the matron as enemies in the hospital. For example, now if a matron is giving directives or maybe trying to bring contributions to the patient's health, and then telling the doctor that, okay, they gave so amount of doses, and from her experience as a matron or as a nurse in this hospital, a previous doctor gave so amount of doses and it was detrimental. The patient didn't actually turn out well. The doctor may feel like, oh, this woman is trying to control me. Does she think I'm still a student? I'm now a doctor of my own. She don't have the right to tell me that. And you see that it's just going to cause the whole thing to just be like as though there's a war, and all the things affect everything, just affecting the patient. So I think that it needs to be this. We need to build this oneness,
Coherence.
Coherence. Like I said earlier, a student doctor has the right to actually maybe not in the exam settings, but maybe just as he studies in the hospital, he has the right to always ask the pharmacist for directives. Like there's one hospital I visited. This was the relationship. Like doctor sometimes you make it, but I see this relationship mostly in private hospitals because they know themselves closer in private hospital than government hospital because in government hospital there is a lot of bureaucracy, but everybody has their own, everybody cares about what they're
Yeah,
doing.
yeah.
So, but in this private hospital, this doctor he made a prescription, but he was not 100% sure. He was trying to weigh the impact because I think the prescription had side effects, but it is necessary to be given so that the patient can actually survive. But it has side effects, so we're trying to know which of the drugs will give lesser side effects based on the patient's anatomy and how the patient is in that situation. So he had to ask the pharmacist.
Pharmacist.
The pharmacist gave contributions, and they were not able to give the patient a good medicine. And then the patient went on fine. So
So
it's still the
in that case,
collaboration.
there's collaboration,
Yes,
and
it's a
then
collaboration.
we have to
Collaboration.
believe the best
Yes,
possible
yes,
treatments.
exactly. So that's the second thing, the collaboration. But yeah, yes, we're talking about how we're going to solve it here. So what I think we should do is we start working together from a student level. You know, practical. I think we notice a little bit of relationship. When we're doing practicals here in UNM. But the problem now is that we don't have enough resources, but yeah,
Apparatus.
apparatus to do the practical.
Practical.
But actually, we do the practicals together. There is no. Although sometimes we don't even do it together. They
We
do it
don't do it
medicine.
together.
Yeah, we do it yes, medicine their own. But we
Together.
need to start doing it together. Even when they are doing their when they are doing their, I think they should post doctors and nurses to the same time. Like they post doctors in this hospital. They also post student nurses
Some
there,
nurses.
and they work together. Or if they post you as a student doctor, you work with the existing nurses there, and let nurses not see you as less. Let them even be open to teach
Nurses,
you.
it is the doctors that now
Yeah,
see
most
the
times it's
nurses
even
as
yes,
less.
it's even the doctors that do
Not
the
not
yes.
yeah.
So and also we don't talk about another thing we should need to do is, like I said, one of the reasons why people do this Japa is because of the dignity associated with the job. People don't actually first they don't have the resources they need to perform very well, and then it turns the image. Maybe when patients know that this doctor have actually killed 10 patients this month,
Ew.
but they don't know what happened. They don't know whether there's enough resources. They don't know whether the patient had insurance or health insurance. All they care is that this person killed 10 patients, avoid him at all costs. So you see, it's very degrading as a professional, knowing how many years of experience you have had, and so you can't get your work done well. So yeah, the government have to also actually look into funding this thing. So, but the problem now is like the current case that I think earlier this month we had National Association of Resident
Resident
Doctors
doctors.
are going on strike, and then one of the controversies now is that the number 14 of their demands, what they demanded from the doctors, from the body, that they should be your interpretation. I don't actually cannot state it as exactly how it was, but the interpretation is that there should be lesser um, consultants for other practitioners. So yeah, it causes confusion in the hospital. And one pharmacist made a valid, one doctor made a valid point on social media on TikTok. He said that you know in other developed countries which are trying to copy, that what they do have there is a chief nurse or a chief pharmacist in the hospital. They don't have a consultant pharmacist. They don't have a consultant nurse in like countries like Britain and all that. So but we're trying to have consultant notes. And it also boils down to this feeling of inferiority some of them do have, which I won't blame. Like a lab scientist now is looking to be a consultant because and when you ask them what is the profession, like I'm a consultant. Some of them don't even go further to tell you consultant what. The nurses do tell you. I've seen nurses, they will tell you I'm a consultant nurse. You get. So but you see, and I won't say that these people are right or these people are wrong, but the both of them are trying to dominate. This person is feeling like okay, they're not dominating. This person feel like they're being talked less on and all that. And also when it comes to leadership, most of the leadership positions in the health sector is doctors that hold the positions. Community medicine is being neglected. There are some doctors that they are in charge of community medicine. They know how to handle a particular set of people. To suit. They know the kind of medication to suit so and so. Then the other thing mentioned, I think this is the third point. So they can actually say what you have thought so far about what I've said anyway. You can actually contribute. Then the
It could just
okay,
continue what you're
okay,
saying.
okay. So then the last thing I feel we should actually do is go deep on research. Get like you mentioned, people don't actually even care about traditional medicine. You have already written off traditional medicine as to give you kidney failure. You want to take that. Like I remember when I was young, my mother used to give me this ogre Igbo, like for malaria. I had one high malaria then. So she gave me one, I don't know, it's a concussion, one stop something. My grandmother had to make sure she gave it to me. And then she gave it to my giant kids. And I had to rub one thing, one brownish something, I don't even know the name, on my belly, all that kind of stuff. I actually got myself full. So you see, but people now, if you tell your doctor that, oh, I'm taking this, they'll be like, ah, you want to kill yourself, this is going to affect your kidney. But they're not actually done research on those. And you are expecting the whites to come and do research in your country. But when they come, you see that they're coming to see mineral resources. So you see, we are all killing ourselves. Yeah, like killing ourselves.
It's very chaotic.
Yeah, it's very, very chaotic. And it's very, I don't even know, like, this is just the first solutions I feel like we
Yeah.
should implement
Man.
at this point.
Yeah, yeah. I think you are. I think I agree with you. And the research parts is not even just research, practicals. You
Yeah.
also need practicals as for testing and everything. Everything still boils down to research. And
Mm.
those are things that we should invest in for our
Mm.
healthcare system to improve.
Yeah.
Yeah, so even with all these problems, and
Mm.
this, let's not talk about me now. Let's talk
Okay.
about you. Even with all these problems, yes, I think you still seem to want to. Why do you want to study medicine? Is it
Okay.
because you want to treat people, or you want to make money?
Okay, yeah. Most, I'm sure every medical student have
No,
asked
no,
this
no. I'm
question.
talking of you now.
Yeah, yeah.
Do you want to make money, or you want to? Because there's no money in medicine. If you are going there to
Yeah,
make money, you are going to
I'm
be
going there to
disappointed.
treat patients.
Okay, you're
That
going
has
there
been
to
my
treat
passion.
patients. Okay, you have care.
Care.
You want to treat patients.
Exactly.
Wow.
Of course, yeah, of
Wow.
course. I have this passion for the cause.
Mhm.
Yeah,
Okay, so let me play the devil's advocate
no
now.
problem.
What if a situation whereby the Nigerian healthcare system is the same way as it is, that there is no change, it even deteriorates further? Will you still remain in medicine?
I'll remain in medicine, but then I'll have no option than to take the route every other medical.
Japa roots.
Yes.
Meaning you don't even actually care about Nigeria.
I
Say
care about
you
Nigeria.
just want to
I
just
need to. I need to learn. What I will do is I will jump because I've seen that most, like I said earlier when I was talking that
yes.
most of the solutions I've been profiling. Some private hospitals actually have the solutions. They are actually implementing them, like the collaboration. All
But
this.
then when you have one, two private hospitals, or let's say 10 private hospitals for the entire country, it's not possible now.
You know,
And it's only the rich that can afford those private hospitals. Because the only way they are using to maintain those private hospitals the way it is by people are paying their bills. And
yeah,
it's only the rich that
okay.
can pay their
I'll
bills
refer. I'll
effectively.
refer this question to something. Nnamdi Azikiwe did.
So
When the country was in chaos, everybody
yes.
was they were fighting for independence. What did
Mm-hmm.
he do? He went out of the country and studied,
Okay.
got the qualifications, knew how the system worked, knew what to do,
Knew
and then
what
he
worked
came
and what
back.
didn't.
Yes, then came back and then fought for it. And when he was speaking to the white, they knew actually this person knows what he's saying.
Yeah.
So that's the same thing. But now it's not that no longer you're talking to the white, you're talking to your own people. So,
Yeah.
but then when you come there, you already have the connections.
Yeah.
Some NGOs are even backing you up
Yeah.
because they're ready to invest, and
Maybe get the relationship.
some of our Nigerian NGOs also exist there. So they can be like, okay, this person have a good solution.
Yeah.
What do we do first? Be like, okay, let's start with the students. How do we improve
Yeah.
how they feel about medicine? Because it also comes to the mindset.
Change the
Yeah.
idea.
So you say, how can we make them feel better about medicine? How can we make other professionals?
I don't think it's even necessarily feeling better. I think it's making them know that when they are entering medicine,
Yes,
they should want to treat patients, not enter there to make money.
yeah.
Because if they're entering there to make money, we'll just have not quack doctors because they might actually know what it is, but then you're not treating. There's this thing that I heard that doctors they don't treat the patient, they don't treat the disease, they
Mm.
treat the patient. Even if it's the same particular sickness for different patients, the same way you talk to this patient
It's
is
not
not
the
the same
same
way you
way.
talk to this
Yes,
other
it's not
patient. You have to have emotional intelligence to be able to,
exactly.
and then for you to even have that, you need to really be passionate about it because not just coming there to make money like most of us are doing. Let me not say all of us,
So
because
so
I think
so
I believe there are some people
yes.
that still want to.
So to answer your
Even,
question,
even if you are denying that you are not coming here to make money, let me not say denying. Even if you are saying that you are not coming here to make money,
yeah,
but then
that money is important. So everybody wants money.
eh,
So, but when you make it easier for them to get the money, They won't have to go to struggle for it in their
Let's
their
not even say easier for them to get money.
like you
Let's even
always
say,
give
let's
them.
say, let's say, giving them their worth, giving them their
Yes, what
work's
they are
worth.
worth,
Yes,
exactly.
that is what we need. That
Because
is what we need,
outside,
not just.
in abroad, they actually perform better. Like when you see people that actually go out of this country, they go there and they do very well. So it's showing that it's not about the competence or about them loving the job because they
Yeah,
actually love it. But it's just that you don't have to now start thinking about I've not gotten my salary
how
for
you
last
feed
month.
your
Yeah,
family and
because they already know that that's already being settled. You get, and some people go to the extent of giving them free health insurance, giving their family,
yes,
scholarship
yes,
and all that to make sure that they are
incentives for them to
incentives.
continue to
Exactly.
do the
Yeah.
work that they are doing
So,
because they are very important, whether we like it, whether
so
the government likes it or not.
yeah,
And the thing is that why politicians any more than doctors? But that's a topic for another day. Let's
yeah,
before
okay.
it to be as if
Yeah,
let's not
yeah,
cause controversy, please.
yeah. We have to anyway at some
We
point,
have to again.
but
It's inevitable, yes. But
yeah,
then
but let's just
why
keep
would
it
they be
on.
any? What are they doing? They have convoys and everything, but then our doctors don't have.
Yeah,
Why won't you? I beg, let's not even get
okay.
there. Yes, I think you have answered most of it. If we could decide to continue now, we're not going to end because the problems in Nigeria
Is
is
massive,
endless. It is,
massive.
it is something. It is something. I don't know. If you just look and if you decide one day to start thinking about the problems of Nigeria,
You
you
would
become hopeless.
like
Become hopeless. And I'm also passionate about wanting to change the Nigerian healthcare system.
yes,
If I should eventually become a doctor, I don't want to practice because I've not entered here to treat people. I don't. I don't sound evil. I don't enter here. I thought there was money inside. But when I've done research, I've at least I'm exposed in a way that I know that there's no really money inside. And then why waste my time when I know that? Let me not say waste my time, but then why go into the field? I might even want to, but then I'll not be happy as a person. Even if I'm treating the patient, I'll not be happy as a person because that is just limiting what I want to do in my life.
so
So
we have to change.
in the way I'm trying to change the healthcare system is I'm doing something called, should I say the name now? I'm doing something whereby I'm a telemedicine platform. These things exist already. To fill in for the doctor ratio, the patient doctor ratio in
Yes,
Nigeria. Not just that, and many other problems in which I plan to solve. So it's still in the which phase? The dormant
let's
phase, not
yes.
dormant, but then it's still
Test
in the growing
phase.
phase, not testing. I've not really
Okay,
done
okay,
anything.
okay. Yeah,
It's still in the testing phase. No, no, God, you have put words inside my mouth
yeah.
now.
You're still
It's
incubating
still,
it.
yeah. I'm still breathing. I want to do something that nobody else has ever done. Because there have been, what's it called? There have been there are other telemedicine platforms in Nigeria,
Exactly.
but then I want to, would I say, I want to focus on their limitations, things that they don't also get to address. Because if they were as effective as they are
Exactly.
supposed to be,
Yeah.
at least there should be a significant decrease in the will I say bad nature of the healthcare system of our country. That is, at least we should go see improvements. Yes, I'm not saying they're not making differences. They are making a difference in their way, but then I don't I don't think anybody that I know. I've not seen anybody that uses those platforms, but they exist. They exist. Yes. So I think there are different things we need to work on. So this is just one part of the things I'm working on currently. The name of this thing is called Get Care. Get Care.
Okay.
For
Wow.
I'm going to first of all start with Nigeria, then before I go to Africa. And this is not just about making money; it's actually about bringing change to the society. So, and to do something like this, you need a lot of money. You need to raise money. And so, if you're a donor, if you're watching this now, you know you have money. I beg, come and support. Come and support
Of
me.
course, it's
I
necessary.
really have
Yeah,
passion.
yeah.
I really have passion for it. I think it's something that can actually work out very well. I think it's something that can actually work out very well. And then let me just chip this one in. For what's it called? I watched one podcast with Aproko Doctor and Stephen Akintayo. I don't know whether you know him.
Okay. Yes.
They said that the reason why private yes, the private sector and he was talking about the private sector and the public
Public
sector.
sector. Okay.
The reason why private individual people that have money don't want to invest in the healthcare system of Nigeria is because it's not profitable. Because at the end of everything, if anybody that is investing in anything cannot be doing it out of charity,
Yeah,
it
it's
has to
true.
be profitable.
Yes,
And
exactly.
then that profitability leads to sustainability. That is, it's something that is going to it leads to continuity in the that is if they should invest, it improves the healthcare system generally, and they need to get their money back and even continue and make profit. it might seem as if that's why would they want to make profits? But then anybody that wants to
Yeah,
invest
every
at all,
investor has to make.
if it's like that, you that has the money, you can invest and give them for free. That is my own belief. It has to be profitable
Yeah,
one way or the other. So yeah, this is just we're just scratching the surface. But then I believe these conversations needs to be had among us, us that are still growing to become medical doctors, others are still going to become medical doctors. These conversations needs to be had because at least so that we become aware. So that when we get there, if we decide to wait till we get there, we'll just follow the system and just continue
you
to
have
go.
to change it
Yeah,
while
I
we are
believe
getting
it.
there.
Yes, from as long as we have already started school, in any little way we can, creating awareness, different things we can do, like the what I try to do, and anybody that's willing to collaborate, anybody that wants to join me in this particular journey. But then if you are joining me, know that you have to be serious. So let me just put that one shot. Like, yeah, so there have to be a serious person that beg because it's not a small thing, it's a very big thing. Anybody that's willing to join to want to improve the Nigerian healthcare system, I
Yeah,
think you already shown interest. You have already shown interest and your concern is very valid. These are the kind of people that we need in our society. Not all those children that are just watching social media and listening to music and watching movies. So yeah, I think this is where we end it. But
yeah.
before we end, is there any other thing I want to ask you? The other thing I want to ask you: if you eventually venture into medicine, then will you focus full time on medicine, or will you decide to just, I mean, you do other
Mm,
things,
yeah, I will do medicine and also do business
a
because
business?
in
You
the kind of
want to make money.
everybody wants to make money. But the kind of
That's not the question I asked you. I said you want to make money.
of course I want to make money now. I look at it here was so that why I'm doing
Yeah,
it is when you are so you if you only know that you have security and this plan is a kind of proactive
yeah,
based on the already existing system
yeah,
so that you won't hope like everything just miracle and
yes.
everything will happen and the whole problem of Nigeria is solved. So but when you don't get there, you do know you have backup. So you're not going to
Take back up.
yeah, no,
I understand. Clear is clear. I
not
understand
back
what
up
you want
like
to
you're running
say.
away, but so that
Yeah, I
when you're
understand.
treating a patient, you're no longer caring about when they pay you
Money.
salary or what. You're treating
Exactly.
patients with
This is
the
this is
full care.
if you should eventually have a hospital, this kind of person that you want to go to the hospital because you know that at least he will treat you how a doctor is supposed to
Yeah,
treat a
you
patient.
don't need to start worrying about the
Yeah,
money.
I think we'll end it there, and I would love to have you on. I want to talk more, but then there's no time. I think are you not tired? There's no time here. So I would love to have you again, maybe subsequently. Yeah, I just hope I know when I call
Yeah,
you, you're going to answer again because this is the topic that
definitely,
we need to keep on talking about.
definitely.
And if there's anybody that is interested in having a conversation, because the purpose of this podcast is not just about the healthcare system, it's just trying to help our generation, the new generation. As the name implies, the Nigerian dream is not just on healthcare, it's also on
Yeah,
education, it's also
everything.
on other particular aspects. And I feel that if we just attack these problems as different fronts with different people that are passionate about these problems in different sectors. If we can attack these problems very well, I think we're able to solve Nigeria's problem. I think we can become a better country without even actually going abroad. Because at the end of everything, nobody's coming to save us. Yeah, nobody's coming to save us. If we don't do it ourselves, nobody else is going to do it. And I think people just need a little push for for them to be able to at least to be able to. And when they see people joining towards coming towards this movement of trying to change Nigeria as a
Yeah,
whole, I think
exactly.
everybody will want to involve themselves. That involve me trend, Abi.
Yeah,
Everybody
involve
wants to
me.
involve me. This one is involve me, but do you have the mindset to want to you have the
Change
mindset
the
to change.
system.
Is your mindset Japa be wanting to change the Nigerian system as a whole? Nigerian system as because if you don't, our leaders will continue to capitalize off our silence. If because we yes, they continue to capitalize over our silence. These people are not complaining, so we can continue to steal the money. And not say if I'm
Yeah,
stealing money, you don't come out. Anyway, if you sue me, I will defend myself. Yeah, so that's it. So I just hope people enjoyed this episode of this. I hope people enjoyed this episode of this podcast. And see you on the next one. How do you even greet again?
this guy, I don't.
Good afternoon. How are you doing? Why am I even greeting you, Seth? Good afternoon, Joseph K. Good afternoon, Joseph.
After
How are you doing? Wait now. Good afternoon, Joseph. How are you doing today?
doing very well. I'm very glad to be here. Thank you for having me.
I don't know what to tell you again, no. Honestly. And cut, please. Because I know forever I saw. Just look at this fool.
Like,
And if there's
I'll be here.
don't worry, continue, just continue, don't be looking at me.